Welcome to Talk Me Healthy. Each show, we invite a guest to explore a topic related to healthy living. They share their expertise and personal stories, and we learn from them how they turn their passion and knowledge into practical tips that you can use now to improve your health. I'm your host, Scherrie Keating, founder of Diabetes Care Consulting. My goal is that each show you will hear something that will motivate you to make a small but significant change towards living a healthier and happier life.
Hello and welcome to Talk Me Healthy, TV show and podcast. My name is Scherrie Keating and I'm your host and also the founder of Diabetes Care Consulting. As you can see, we are actually remote and following social isolation recommendations. So we are speaking from our homes, and I hope that everyone who's listening is safe and healthy. So I wanted to bring you some very important information and also hope to add peace to families who have loved ones living in assisted living communities. And I've invited my good friend and guest, Jodi Tolman, who is the Community Sales Director at Whitney Place Assisted Living and Memory Care in Sharon, Mass. So good afternoon, I should say. Jodi, how are you?
I'm very well, Scherrie. Thank you so much for the invitation. I'm really glad to be with you and to talk about what I think is a very important topic.
I know. I really feel like if I had somebody living in a senior living community or in memory care, this would be a very challenging and scary time for me. And I really want to help the viewers to understand what is going on, because I don't know if they can actually even go in and see their loved ones. So I want you to shed some light on that. And so, what are senior living communities doing to keep residents safe? How about the staff? Are families allowed to come in? I mean, there's so many questions. So I'm going to let you take the lead because you're the one who's living this.
Sure. And I very much appreciate the opportunity to get this information to people that I think really need it. So as we all know, the senior population is one of the most vulnerable through this time. And senior living communities of all kinds all over the country, if not the world, are doing everything they possibly can to keep their residents and their team members, their staff safe. So at Whitney Place at Sharon, we are taking our lead from our parent company, which is Salmon Health and Retirement. Salmon Health and Retirement owns 6 senior living campuses in Central Mass, and they are taking their lead and guidance from the entities that you would expect: the Centers for Disease Control, the Executive Office of Elder Affairs in the state of Massachusetts, departments of health, and so forth. So all of the directions that we are being given, the precautions and safety measures that are being taken are coming from those experts. So at this point in time, the prime objective is to limit exposure of our residents to everybody, as many people as we possibly can, other than essential personnel. So, for example, and it's profoundly unfortunate and difficult and challenging that families are no longer able to visit. We were allowing family members whose residents were living on the first floor to come and visit through their windows. We cannot do that any longer. So our residents are no longer gathering for dining in our dining room, for any engagement in social activities such as concerts and performances and speakers and art classes. All of our residents in every one of our campuses are being isolated, for lack of a better word, in their apartment. Meals are coming to them. Engagement through our internal television channel is coming to them. Our teams are doing an incredible job of engaging our residents, stimulating our residents, and helping them to feel safe and connected. So those are some of the kinds of really pretty intensive measures that have been put in place to ensure the safety of our residents. And that's very, very different, because one of the most important facets, one of the greatest benefits to living in senior living communities is the socialization and engagement.
Right.
And that has been pretty severely curtailed right now.
And how are the residents dealing with their isolation in their rooms? Because they really are just, they have apartments, but they're in their apartments and they're isolated. So how are they actually emotionally dealing with this?
It's been actually remarkable to see. Our residents in Whitney Place in Scherrie have been amazingly resilient and supportive and patient and kind and understanding of what has been put in place. Of course, as you can well imagine, their primary is to stay healthy. And so they so appreciate our efforts to help keep them safe and healthy. So I'm sure that, their lives are a lot more quiet than they were a few weeks ago, but for the most part, thus far, they have, they're holding up to this really remarkably well.
So that's great to hear.
Yep.
How about, what if they don't have access to like technology so that they can be connected to their family? Are you providing anything for them?
Absolutely, that's a great question. So yes, many folks of this generation are not technologically savvy. And so our team, our recreation team, our caregivers, our dining, our culinary services team, everybody is doing everything they possibly can to engage residents one-on-one within a 6-foot social distancing protocol, to help them speak to their loved ones via FaceTime, for example, or Skype. A lot of programming. We are about to launch a program with the Scherrie Public Library, a pen pal program. So a lot of the kids who are stuck at home, because schools are closed, will be writing letters and sending pictures and drawings and so forth to our residents. And they will then write back. So we've been, our rec team, especially headed up, I should say, by Allison Carsey, incredibly creative and just thinking out of the box. So a lot of support and assistance with technology when that makes sense, and a lot of different kinds of, like, for example, exercise classes virtually every morning on our internal channel. So we're really working hard to keep our folks busy and active.
I love that. Exercise
and connected.
So important.
And connected, I would add, because especially now that the family members cannot visit, we want to be certain that they're connecting with their loved ones.
So I love that. And I feel like I've been more connected with my family than I've ever been. I mean, I used to see my grandkids all the time, but now I see them on video chat every day. And, my grandkids just found this new Messenger Kid app. And so every 5 minutes, my little grandson's sending me a picture, or he's sending me an I love you, or it's just adorable. And it's just, our family now has a family Zoom call every Sunday. So I think the one good thing, if we had to look at the big picture, the one good thing is that we're all trying to find ways to be connected, and we are maybe more connected with those that we love and care about now than we were before.
I would absolutely agree with that. That's been my personal experience. And I also see it professionally through how our residents are connecting with their loved ones. Yeah.
I love it.
Yeah, I would agree.
So tell me about the families. How are they dealing with all of this? I mean, I would want to be with my loved one. And so how are they dealing with it? And what kind of updates are you giving them? And how often are you speaking with them and all of that?
Communication is absolutely key at any time, let alone in a situation like this that has been and will continue to be protracted. So our executive director, Brian Patterson, has been amazing. And he is in constant contact, as is our leadership at our corporate level and all the way down with families. We have daily, sometimes updates on our website, the Salmon Health and Retirement website. There is a portal specifically for family members. So we're communicating very often and very transparently and honestly with our families. They, just like their loved ones, have been incredibly appreciative, understanding, and supportive of what we're doing and how hard we're working to keep their family members safe. And I'm sure through their personal connections with their loved ones, they're finding their creative ways to stimulate and engage their mom, their dad.
That's wonderful. What about the staff? I mean, at this time, it must be very scary for staff to go to work every day. I know I have family members on the front line, and thank you to all of you on the front line, no matter what area that you're working in, whether you're in healthcare, you're at the grocery store, you're at the pharmacy, to everybody who's working during this crisis. We can't thank you enough. You are really, truly heroes.
Absolutely.
So your staff, what are you doing? Are you screening your staff every day when they come into work? How are you protecting your residents from your staff and your staff from your residents?
Great question. Important question. So every single person, first of all, no one is coming into the building who is not considered essential. So no performers, no delivery people, no family members, no one is coming into the building unless they are an essential, they're essential personnel. Every single person who's coming into the building every single day has to answer 3 questions. Have you traveled outside of the country? Are you symptomatic? Have you been in close proximity to anyone who is symptomatic, or have you tested positive for the virus, and so forth? And we take their temperature.
Okay.
Before the start of every single shift. If someone has a fever of 100.3 or higher, they are immediately sent home to self-quarantine. And we are following them, of course, and making sure that they're getting the care that they need. So that's how and just recently, as you likely know, the guidelines have changed so that it is now being suggested that everybody, well as sick folks, are wearing masks and gloves. So our caregivers, our personal care attendants, our wellness nurses, everybody who is interacting with our residents and staff are now wearing gloves and masks at all times.
That's great. Have you had anybody sick in your community with COVID?
I'm now knocking on every wooden surface I could possibly find
I'm knocking with you.
to say no. We have been, it's both luck and through astonishingly hard work and vigilance that we have managed to keep the virus out of the building. And also, I would say, to get to to go back to your last question, as far as how does staff feel, it's really quite amazing to see our frontline folks, our aides, folks that are working with our residents every day, coming into the community every day with smiles on their faces, tremendous energy, and doing what is necessary to keep our residents well and safe and healthy. It's been quite something to see.
Kudos to all of you. And I'm sure, we're talking about your community, but I'm sure all the other communities across the country are following these same guidelines. So
exactly.
And I know some communities, unfortunately, have been, some of their residents do have COVID, and, they're having to move people. So I'm so grateful that your community, everybody's healthy and well. And it sounds like everything is running very smoothly, actually.
It is. It's we're bracing for changes. Everybody, and I would also add that our company, Salmon, has been going to great lengths, not only to keep staff and associates physically well, but also emotionally and psychologically well. There are lots of resources, and financially, there are lots of resources in place for all of us to help us just take good care of ourselves and be as well as we possibly can be.
So saying the resources, do you have all the personal protective equipment that you need? Is that an issue for like assisted living? Like the hospitals are having a terrible time. What about assisted living communities?
My understanding at this point is that all of the Salmon Health and Retirement communities, including our skilled nursing facilities that we own and operate, have the PPE, the personal protective equipment that they need, and are continually sourcing, because it has to be changed with every encounter with a resident or patient.
Right.
And so great quantities of PPE are necessary, and they are constantly working to source and procure additional equipment.
That's great. So how's your memory care? I know you have memory care, so is that a different story? Tell me a little bit about that.
Memory, really tremendous challenge, because when an individual is living with dementia or Alzheimer's, engagement and stimulation and social stimulation is particularly important and critical.
Yes. And structure too, right?
And structure, exactly right. Isolation is a tremendous challenge. And what can happen is that if you choose one safety measure, such as isolation, it can create equal, if not greater, challenges, such as unwellness among the residents in our neighborhood, in our Tapestry neighborhood. Shannon Bateman is our director of Tapestry. She has, I keep throwing out these adjectives, but they're fitting. She's done an absolutely astonishing job. So far, again, everybody's healthy, and she is social distancing. She is creating social distancing to the extent that she's able, and at the same time caring on an individual basis with all of her residents. And so far, it's working. Because
memory cares are usually open concepts, right? Because people can wander through the unit and even outside safely. And so yes. How are they being, isolated in a unit that's usually open? Because that must be a huge challenge.
It's a tremendous challenge. And I have to say, we're not able in every single case to isolate a resident, because we tried that. And it created some very real issues and challenges.
I can imagine.
Those folks who can handle the isolation are isolated, and those folks who cannot are not constantly isolated. And so we're just taking every precaution we possibly can and being as careful as we possibly can to keep them safe and healthy. Mm-hmm. It's not, in this regard, in terms of memory care, it is by no means a perfect science.
Well, we didn't plan for this. We didn't realize that this whole crisis was going to become a pandemic. And, it's not like we had this whole policies and procedures in place. So everyone is doing phenomenal, with what we have and what we've been given. And, it sounds like you guys are doing an amazing job, and I'm sure assisted livings across the country are doing an amazing job as well. And I'm sure it gives family members peace, yes, knowing that you guys are going above and beyond, and that their loved ones, since they can't be there, that their loved ones are being cared for as if you were their family.
I believe that that's true. I certainly hope that that's true. That is one of our primary objectives, is to calm the panic, the fear, the nerves of not only our residents, but their family members. One great example of how we're sort of thinking outside of the box, and how above and beyond we're sort of going to engage our residents. We brought in a performer who did what we called a rolling concert. He was outside on a beautiful day with his, I guess, a synthesized keyboard and what's that word? An amplifier.
Yeah.
And he sang on each side of the building. He moved around the building and sang on each side of the building, so residents living on that particular side of the building could see and hear him. And it was just fabulous.
I love that.
I do too.
It's great. And, I'm sure, have you been feeling any anxiety through all of this? I know you're working remotely from home, but you're still, in it every day. So how is your anxiety and how are you dealing with not being with your community and your residents that you care about?
I have to say, first of all, I appreciate that question. And I have to say, this has been the most mixed up bag of emotions I think I've ever experienced, just like everybody on the globe.
Mm-hmm.
For me, I feel some, even if it's an illusion, I feel some sense of safety being able to hunker down at home and not be interacting with anybody other than my husband and my son. On the opposite end of that is tremendous guilt. I feel tremendously guilty because I'm not in my community supporting our residents and their families and our staff the way much of our team is. So I feel tremendously guilty, and mixed up in all of that is how much I miss my residents who I just adore. And my team members. It's tough, but I feel incredibly grateful to be healthy, to be employed, to feel safe, and I'm doing okay. And I hope you are too, Scherrie.
I understand. I can so relate to your feelings of being helpless and not feeling like, because I'm a nurse myself, and I'm at high risk and my company is no longer, and I feel like I should be on the front lines as a nurse because I have all this education, but for me, I'm at very high risk. Right. And it's not safe for me, and so I have that guilt too. Yeah. And I feel helpless, and so I want to do these kind of shows and podcasts so that I feel like I can bring something to the table to help somebody through this crisis that we're having. Even though it's not nursing per se, I can help in this way. So this makes me feel good that I can do this small little thing to make a difference in helping somebody bring peace, knowing that in this particular show that their loved one who is in assisted living is well taken care of, is being cared for by people who care about them, are using all the precautions and following all the guidelines. And, at the end of the day, it really is all about the resident, living there and, the staff safety and the family's peace. So it sounds like you guys are doing an amazing job, and I'm sure they're so grateful.
Well, I appreciate that, and I know they are, and I feel exactly as you do that, and why I was so appreciative of this opportunity was so that I could do the same, is to just provide something of value, something useful, something helpful, and I certainly hope that I've done that.
Oh, you absolutely have. I'm so grateful that you were able to do this, and I also hope that your residents continue to stay healthy, and that this I wonder what life is going to be like after all of this. Do you ever think about that? Like, what is our
constantly.
new normal going to be? Is it going to be changed forever? I don't know.
There are lots and lots of experts, as you likely know, who are writing and thinking about that very question. I don't think there's any question that this experience will change life on this planet forever. I don't think that's exaggeration. And shame on us if we don't let it make certain changes that have been, things that have been revealed to be broken. We have a lot of work to do in many regards, but one of my great concerns is how will it affect us all in terms of how we interact with our fellow human. And I think great good will come from this, and I think unfortunate things will linger from this.
Yes, it's such an emotional roller coaster every single day.
Absolutely.
And I know myself, I have a lot of anxiety. I'm not one to have anxiety on a regular basis, but this has really been anxiety provoking because, family members on the front line and not seeing my grandkids every day in person. And it's been hard. And so it's okay to be emotional during this time. I guess I want to empower people to feel what they feel because, we're human beings. And, this is so life-changing for all of us. But I also, in all of this emotion, I also have seen so many blessings, and yes. So I try to focus on those positive blessings every day and find something to be grateful for every day, and also to keep people to remember that they still have to take care of themselves through all of this. We can't just let all of this cause so much anxiety and fear that we're not taking care of ourselves. So I empower people to still remember that they have to do self-care. Whatever that looks like for them, exercising and eating healthy and connecting with those that you love and continuing to reach out and offer any help in any way to anybody. And you guys are doing amazing, and I'm so grateful, and I'm sure everyone who is a staff member, who is a resident, and who is a family in your community, in your larger organization, and those across the country are grateful for all the work that you're doing. So thank you, thank you, thank you.
And thank you, Scherrie. And please take your own advice, stay well, take very good care of yourself. And to everyone out there, we will get through this together. There is life on the other side of the coronavirus, and we'll stay connected. We'll be loving and kind and supportive and nurturing, and we'll be okay.
Absolutely. And my favorite saying is, together we will make a difference in the lives of many. And I think that's what we're doing. And so yes, thank you so much for being such a great friend. I'm so grateful to have this opportunity to see you. I've missed seeing you. And Thank you again for coming on. And I know that this show will touch somebody's life. And so I'm grateful that we were able to do it.
Thank you, Scherrie. Thanks so much. And I hope to see you face-to-face ASAP.
Yes, me too. And stay healthy, my friend, will you?
You too.
All right. I'll talk to you soon.
Sounds great. Bye-bye.
Bye-bye. And thank you to the viewers for tuning in. And this show will be available, and it will also be available via video, YouTube, and also by podcast at Talk Me Healthy. So thank you, viewers, for tuning in. And I will stay connected, and you please stay connected and be safe and healthy. Have a wonderful day. Bye-bye.
Bye-bye.